Today, we are talking about patient-centered care for people with multimorbidity.
We are focusing on 4 questions including what is patient-centered care, what is multimorbidity, why this topic is so important and what's pharmacists required to know. Let us know what is patient-centered care. Patient-centered care is defined as a philosophy of care that consciously works around patients' needs, responding to individual preferences and trying to ensure that patient values guide clinical decisions. Person-centered care is a mindset for pharmacy practice which involves an equal relationship with patients, respecting their expertise in their lives, condition, situation and beliefs. Additionally, research has demonstrated that involving patients in the decision-making process results in better outcomes, such as increased patient satisfaction, better adherence to treatment regimens, improved functional status and optimized self-management. What is multimorbidity? Multimorbidity refers to the presence of multiple chronic or long-term conditions that could include both physical and mental disease. Why this topic is so important? According to Australian Institute of Health and Welfare, nearly 1 in 4 Australians suffer from 2 or more chronic health conditions. Given the increasing number of people with multimorbidity, the discrepancy between the care needs of these patients and the way in which their care is organized is becoming increasingly visible. What is pharmacists required to know? 1. Increase pharmacist awareness of challenges. 2. Educate pharmacists about the benefits of patient-centered care. 3. Educate pharmacists about strategies to deal with persons having multimorbidity. Challenges faced by people with multimorbidity. 1. Patients with multiple chronic diseases experience important treatment burden in terms of understanding and self-managing their chronic conditions. 2. Attending multiple appointments which is challenging for a person to move one place to another. 3. Increases the rate of mental illness such as anxiety and depression. 4. Having multiple chronic diseases is also associated with poor quality of life as well as increased mortality and disability rates. 5. Cost of medicines. 6. Number and type of medicines a person is taking and how often is restricting their lifestyle. We have known these challenges. So what are the benefits of patient-centered care? First benefit is that increased patient satisfaction with care. Second benefit is that increased well-being. The third benefit is that increased treatment adherence. It is important for patients to follow the medical direction. The fourth benefit is that better self-management. The fifth benefit is that increased trust of the healthcare system. The sixth benefit is that it may lead to improved clinical outcomes. The seventh benefit is that it reduced hospital readmissions and complications. The eighth is that higher self-rated mental health. The final is that reduced cost of care through better management and coordination of care, that leads to the prevention of hospitalizations, reduced lengths of stay. There are several strategies that pharmacists can use to achieve patient-centered care with persons with multimorbidity. Some of these strategies may exist, and pharmacists are currently using them in pharmacy practice. In this presentation we are increasing pharmacists' awareness about these strategies. 1. Use of information technology. Advances in technology are creating new ways to access pharmacy expertise, including telecare and telehealth services and the ability to order medications which can be delivered to the patient's home in prepackaged doses. 1. Patient portals. Use of interoperable systems where care can be vertically integrated such that a community-based pharmacist can be mobilized to support an effective hospital discharge and help avoid costly readmissions. This might involve scheduling a domiciliary visit after discharge to check that patients and/or their caregivers understand a medication and its relevance to their condition and are confident and capable in taking medication. 2. Telemonitoring. By the use of e-health applications such as electronic reminders, for example for appointments, medication adherence. digital systems for monitoring symptoms, health status, and for supporting a healthy lifestyle and behavioral changes. 3. Teleconsulting, using either real-time contact via virtual consultation and text or using email or text-type approaches to support communication between pharmacists and patients. 2. Connect patients to other services. Pharmacists can provide broader support for physical and mental well-being by connecting patients to public health services which can be delivered through community pharmacies. They can also signpost patients to local and national patient groups as well as other sources of further help and assistance in their community. One of the examples is Connect Health Organization, and it provides several services. If pharmacists notice patients' need, they can transfer to the organization, which provides occupational therapy, diabetes education, diet and nutrition, and podiatry service. 3. Pharmacists can actively support health literacy so that people are more able to self-manage their conditions by providing patients with self-care cards and consumer medicines information, CMI. 4. Home visiting services can also be offered so that patients who are unable to get out, immobile, can have support from the pharmacy team. 5. Working jointly with the voluntary and community sector. Pharmacists can form partnerships with voluntary and community sectors which will enable them and their pharmacy teams to provide the care and support to people with long-term conditions and their carers. They can also partner together for specific initiatives or awareness-raising campaigns. Any questions?